Hi, welcome back. Today I have an appointment to get a hip injection and to get a consult about my back. So come along with me today. So this is the outfit of the day. Just a t-shirt and leggings. I have two sweaters. It's not cold out, but it's also not hot out. It's just like in the middle. But I have this nice lace sweater, and I have, hang on, let me get it reversed. It just came out of the laundry, but I kind of been trying to figure out things to wear, like sweaters, when I have this thing on, because that gets quite annoying. But I love this hoodie right now. It's when you go through deep waters, I will be with you. Isaiah 43:2. But yeah, that's the back, that's the front. So I'm either gonna wear this, but it kind of, I don't want to wear all black. I'm most likely gonna bring that as like a backup sweater, but this sweater I have had for so many years. I don't remember where I got it. Yeah, where did I get it? No Boundaries. It is No Boundaries. The sleeves are inside out, but I love it. It's just like a nice lace sweater. So that's that. And then I got the brace. I'm hoping today, since he's a sports medicine doctor, he could possibly look at my wrist, because the past like 2 days it has increased in pain so much. Like, and it is really swollen and bruised compared to what it was. So like a whole thing here, all up into here, and this other side, can't really say, but like last night I had a huge bump on it, but I'm gonna see if they can look at it and do anything for it, because it's been quite painful. But I've been using this one for it, but I don't like wearing it because it's just uncomfortable. And I got a more comfortable like sling, but it's too big and it's bulky. So I'm sticking with the one they gave me in the hospital, because I got the other one because this one's not comfortable on the inside. And it touches my wrist and hand, and that hurts. But it's easier to put on, and it fits. But yeah, so that's the outfit of the day. This is the outfit for the day. Yeah, the fit of the day for my Superstar Kim is his vest. His little collar. I'm undecided if I want to put his shoes on. I only have front shoes. I have to get the back ones, but his feet are very, very sensitive. So that's a maybe. But okay, I'm gonna pack my bag a little bit because it needs to be cleaned out. So we're gonna fix it up a little bit. In order to that, I'm just going to probably dump it and then clean the bed, because that's the easiest way. Okay. Ow. This one, it comes out. I have hand sanitizer. Ton of alcohol pads. I have a charger. The problem is they're two ends. So So I might put my other charger in, or unless I have a charger block. But I'm gonna put it in just in case. His boots, Cam's boots, just in case his feet get sore. A pair of gloves. Tons of caps. A drink. And I put like extra hairpins and stuff in there because I never know when I have seizures. So I always like pack a pair of that because I never know. And I'm gonna, for the clothes, I am planning black sweats. There's a big random black sweats and a hoodie because it's comfortable. So I also have to get some supplies out. So right here, because I never know how long I am gone. So I always bring a dose of meds with me because it's much easier to have it than I have it. And I need a ton of slushes. Okay. So like you saw, I already had alcohol pads and hand sanitizer, but I always put an extra one in, and this is Mango Papaya Paradise. So, better syringes, slushes. I do like to spray on hand sanitizer best right now, especially on my hand, but they're not the most budget friendly. Okay, okay, got that. Extra hand sanitizer, because, you know. And then I usually pack a drink and my, so got my essential oils.
Clean up the cupboards underneath.
I didn't put orange in because I kind of couldn't find it. But my GoPro, but I never really use it. But I bring it. My Dexcom reader. And my headphones. And I got an emergency bag. And I'm gonna put my shoes on in a second. Chipstick.
GPS on it.
Extra hand sanitizer. I get chapstick because my lips get very dry. And I have a emergency med. I have more emergency meds in a special bag, but I always like to keep like one on me. But yeah, treats. And then I gotta put my shoes on. These are my shoes. They're just plain Nikes. They're comfortable. I just have the laces very loose and slip my foot in. So yeah. Are you ready to get your hips stabbed? I actually likes him now that he's outside. No. Hey. You're a good boy. Alright, their plan right now is probably to get a x-ray of my wrist and see if I need a cast wrist splint and to do injection on my back. Here's my mom. Hi. And Cam.
Who's down there?
Yeah, I'm ready for the day. It is like 4 o'clock. I'm exhausted, I am tired, and I am in pain. So, we're going to get ready for bed, basically, and just sleep. Can I tell you how the appointment went? Got in there. I got in there pretty quickly. I didn't have to wait a long time. The resident that I had, he was quite nice. Very, very nice. Kind of looked like Noah Kahan though, which is funny to me. Yeah. But he concerning my back and my hip. I'll start about that first. My hip, every couple of months I have to get injections in my hip because they get so painful I can't walk. And this type of injection that I get, they use an ultrasound, but they go in and they find the inflamed ligaments and they find calcifications on the ligaments, and then they take like a needle and they go in and they break them up, and then they inject it with a cortisone, which in theory makes sense because you are creating trauma to heal, but it hurts so bad. And the problem with my back now. Okay, so the problem with my back. I had trigger points injections in my back before. The last time I got a trigger point injection, I passed out way in the middle of it, and they had to stop. So, talking to like maybe speaking with other doctors, I really do need like an injection of some sort to help my back stop being in a state of pain all the time. They don't do it under sedation because they would be able to give me meds beforehand, like prescribe me some meds and then just take it beforehand, but they couldn't even touch my back, so I don't like this option. And trigger points are only like for the muscle and muscle spasms, but they did talk about spine injections where they actually do it in the nerve. So they made a consult for that, and he did say like some do anesthesia, some do not. It depends on who you have in your case and such. I don't think I would be able to do it without it, to be fair, because it hurts so bad. But my wrist. So he looked at my wrist for me because it's been swelling up and such, and it's just been creating more pain and swelling and redness. So he looked at it, said it was quite red. He was worried that I had a fracture that didn't show up. But we did some x-rays and there was nothing new. They did an ultrasound and they did find that I have a lot of inflammation and fluid on my ligaments, and that's what's causing it to hurt so much and why I can't move it. So yeah, that's that. Good. Yes, that's that. So they're going to send me to a pain clinic doctor, and it's probably gonna be like a spinal surgeon or like an anesthesiologist that does it, because with the spinal blocks they do it right into the nerve. Yeah, but yeah, I'm trying this new skincare. It's very like leaves your face feeling very wet, but it dries. And after it dries, it's very hydrating. It was the Evans. I got it from my Ipsy box. I thought I canceled it. Yeah. and this. I should have my other one there. Yeah, I also use this. I didn't use it today. I used it today. So I only use it once a day. But yeah, it's a face oil because it locks in moisture. But yeah, I'm gonna go get some pajamas on and probably gonna rest. Probably gonna sleep. Yeah, thanks for coming along.